Good morning, and welcome to the Colorado Health Foundation's WIC Innovation Funding Opportunity webinar. My name is Amy Strajewski, and I'm the Communications Associate here at the Foundation, as well as your chairperson for today's webinar. Let's go ahead and get started with some housekeeping notes. Our webinar today is being recorded so that others who cannot attend can watch the presentation later. Tomorrow you will receive a link to this recording, as well as the PDF presentation that we'll go over today. We'll also post the recording and the presentation on our website at www.coloradohealth.org. In order to minimize background noise, your phones will be muted in a listen-only mode during the presentation. The final portion of our webinar is devoted to questions, so please feel free to send your questions via the chat function at any time during the presentation. You should see a chat dialog area located on the lower left-hand side of your screen, where you may type and send questions. You will also see a raise hand button, which we will not be using, so you don't need to click it when asking a question. If you have any technical difficulties during the webinar, please call ReadyTalk's toll-free technical support number at 1-800-843-9166. Make sure to have your registration confirmation available. Finally, after the webinar has concluded, you will have the opportunity to give us feedback through a short survey. We ask that you take a minute and complete the survey, which helps us to improve our future presentations. And with that, I'll turn the conference over to Hillary Fulton, Senior Program Officer at the Colorado Health Foundation, and Aaron Ulrich, Nutrition Services Branch Chief and WIC Director at CDPHE.
Good morning, everyone. This is Hillary. I'm so happy to be with you and have a chance to share more with you about the new WIC Innovation Funding Opportunity. First, I want to share a little bit more about the Colorado Health Foundation. Our vision is that Colorado would become the healthiest state in the nation. We are singularly focused on helping Colorados live their healthiest lives by advancing opportunities to pursue good health and achieve health equity. To achieve this, we work to promote a healthy start in life for Colorado's children, including the vital role of achieving sound and appropriate nutrition for pregnant women and young children. And given this emphasis, that's how we came to presenting the WIC Innovation Funding Opportunity to you all. I will spend the rest of our time together walking through the details of this initiative. This funding opportunity will support local agencies administering the Supplemental Nutrition Assistance Program for women, infants, and children. Our main aim is to implement proven or community-developed practices to improve participation, whether that's through increasing enrollment or increasing retention in the program. To provide an overview of the opportunity, the Foundation grant funds will support costs associated with planning or implementation for up to 2 years. We have quite a broad grant range for this opportunity, and that's reflecting just the size of the different eligible entities across the state. As you'll see, we anticipate the grant range will be between $25,000 and $450,000, so there is quite a lot of room for variability depending on the strategies proposed and the number of participating families in the program. You can expect, if you apply in the February deadline, for a review period of about 4 months. So a grant decision would come to you in June. If you apply at the June deadline, you can expect a decision by mid-October. We are also working with the Colorado Department of Public Health and the Environment on a proposal to support the goals of this opportunity to increase participation in the program. And we're also working with them in supporting a potential role for a learning community. We anticipate that the learning community will be developed among grantees to share strategies, to problem solve together, and discuss some emerging lessons. Next, I'll cover some of the criteria for the opportunity. To be considered, applicants must demonstrate and through our online grant application that they meet the following criteria. We are hopeful that applicants will identify clear target populations to increase participation, and we will be giving priority to agencies with the greatest gaps between their eligibility and participation rates. We'll be asking applicants to clearly define the strategies that they hope to embark upon to increase participation. Those should be developed based on what we know of what works and also on your knowledge of the unique context of your community and the needs that your participants face. We're looking for agencies to demonstrate collaboration with healthcare partners or other organizations engaged with WIC-eligible families in your communities. Again, this will be driven by the populations that you identify as top priority and the unique context of your community. We're looking for applicants to engage WIC participants or eligible families in both developing strategies and also interpreting the success of strategies as the work unfolds. And we are looking for you to, through your proposal, use available data to drive strategies and to monitor your progress along the way. You'll see on the Funding Opportunity website some additional resources to support you both in your application and throughout your process in your community. And finally, we'll be asking funded communities to engage in a learning community and an evaluation with other grant-funded agencies. While the learning community will be developed with the group that's ultimately funded, we anticipate that it will include some joint calls at regular intervals along the way, as well as annual in-person convenings. And we are committed to lining those up with standing meetings whenever possible. We wanted to share a handful of examples of the types of projects that we would support, but I want to stress that you need not limit yourself to these examples. First, we are looking for efforts that would include targeted marketing and communications approaches to raise awareness and address myths. We are interested in building community collaborations to strengthen referral networks into your program and vice versa to better support referral from your WIC agencies out to other resources in the community. And finally, we're looking for opportunities to adapt your operational practices to be more accessible and overcome the barriers that you may have identified for participants in your community. This is a fairly flexible opportunity in terms of what types of work can be supported. You may need support with staffing and coordination of the effort, meeting costs, other marketing approaches, and the opportunity is quite flexible for a variety of needs that you may have to accomplish the strategies you identify. I wanted to also share with you what we will measure through this opportunity. At the Colorado Health Foundation, we've identified a handful of indicators that we use to have visibility across our different bodies of work. We call those our measurable results. And in this case, the measurable results associated with the funding opportunity is the goal to increase the number of children and adults who have convenient access to affordable fruits and vegetables. Essentially what that means for you is that if you are selected for funding, we will be asking you to report on your WIC participation rates annually. In addition to that, through your annual reporting, we'd be looking for an update on progress on the work that you've outlined through your proposal and reflections on successes and challenges about what's working well in your community. As I mentioned earlier, we will also be looking to hire a third-party evaluator to support the work. And you can see on the slide some of the detailed questions that we're hoping that the evaluator will help us explore. What are the challenges related to WIC participation? What will it take to improve WIC participation? And how can the learning community contribute? Finally, as you've seen through the announcement, we offer an online application for this opportunity. To get there, you go to the website, www.coloradohealth.org, and from our homepage, you can click on Funding, Funding Opportunities, and then click on WIC Innovation, and there you can start your application, or if you've already started your application, you can access one that's in draft. I look forward to answering any questions you may have, both on the webinar today or in the future as you delve into your application process.
Great. Thanks, Hillary. So as a reminder to everyone on the call, you can submit your questions in the chat box on the lower left-hand side of your screen. Right now we have one question that's come in, and that question is, can local agencies apply for a grant that is greater than $25,000? If so, is there a grant minimum?
Thank you, Kathy. I don't get asked this question very often. I think it'd be worth a conversation. You can apply for less than 25. We wanted to put that out as just kind of a benchmark for people who are trying to think about what is a range for them to consider. If what you're looking to do will take less than that, absolutely we can consider a smaller amount.
Great. And our next question is, for budget planning, can you tell us if the total amount of $25 to $450K is over 2 years or an annual max? What indirect rate do you allow?
That would be a total amount over 2 years. So combined total over 2 years, $450,000 would be the maximum we anticipate. Again, if you have a project that you want to propose that's beyond that range, I think it's worth a conversation. I can give you some additional, more specific guidance in that situation. The Colorado Health Foundation does not allow indirect rates except from university applicants. However, we do have administrative costs allowable that relate to the proposed work. So again, that's something that we can further clarify. I know there's more specific guidance on the website for you, and I'm happy to talk that through with you as well.
Great. And our next question is, do you have an idea of how many agencies you will fund this first round?
That's a great question. I will definitely be considering how much we have for the total opportunity, and we'll be reserving enough for the June deadline to ensure that we can fund other strong projects that come through. Given the timeline, I also anticipate that we won't have too many applications in February. So I don't have a specific target in mind, but we try to use kind of our best estimates of how we might extend the life of the opportunity across multiple deadlines.
Great, thanks. So again, just a quick reminder to submit any questions that you might have in the chat box. We'll wait for a few minutes to see if we have any additional questions that are going to come in. And we have one. So the next question is, do you know the total amount available across the 2 time periods?
Yes. For the total opportunity, including a potential grant to the to CDPHE, we're looking at $2 million.
And the next question is, can this cover something we are currently doing or just new retention strategies?
So we are looking at how can we thoughtfully increase participation rates. So I think if you're doing something currently, we'd want to understand how would our funding help you further increase participation in your community. We'd also be looking at trying to understand whether this would be an expansion of your effort or would we be replacing funding that is lost from another source.
All right, we will wait a little bit more for any additional questions. Great, so our next question is, I would like more clarification on the indirect versus administrative costs that we are allowed to budget into our proposal. Is that something I should talk to Hillary about, or can someone elaborate now?
I'll try to say a little bit more about it, Sloan, and we can talk more if I don't hit on your specific question. So basically, we do not allow an indirect rate, just a blanket percentage that you would apply to your request amount. What you would have to do is justify in your budget and your budget narrative any administrative costs specific to the work that you have underway through this funding opportunity.
Great. Again, if anyone has any further questions, feel free to submit them. We'll wait just a little bit to see if we have any others. All right, well, I think at this point it looks like we don't have any further questions. Hillary, is there anything that you wanted to close out with, or should I go ahead and sign us off?
I'll just add, as you are digging into your proposals, please do reach out to me by email or by phone if you have further questions. Also know that if you are considering applying at the June deadline, I'm working with Erin to find time to come to one of the WIC directors meetings in April to be available for further questions at that time as well. So I look forward to working with you all. I'm very committed to making sure that this feels clear and that you can come to me with questions as you apply. We want to get as many interested applications in as we can. So thank you for making the time this morning. I really appreciate it, and I look forward to working with many of you over the coming months and years.
Great. Thanks, Hillary. So as you all know, this concludes our webinar and our question and answer period. Tomorrow, all participants will receive an email with a link to the webinar recording. Don't forget to complete the short survey that will be available on your screen after we end the webinar. Your feedback will help us to improve our future presentations. Thanks again for joining us, and have a great day.